Recovering from knee surgery is highly variable.
It was going to take forever to get better if I was ever going to get better.
There's got to be something out there besides a CPM machine, which clearly isn't helping me.
Active and aggressive with this thing, or I was going to need
I'm a guy that's not looking to relieve the pain. I'm a guy that's looking to get back in the game.
That downtime was not what I wanted.
We've spent the last 7 years perfecting the recovery system that takes variability out of knee rehab, so you can quickly get back to your life.
Welcome to The Bee's Knees, a podcast full of articles, interviews, clinical studies, and advice about knee surgery, physical therapy, and life after knee surgery.
My name is PJ. This is The Bee's Knees podcast, and this is our third interview ever, really, with a knee patient. So I'm really excited that we have Marisa Rogers here to talk with, to learn from. Marisa and I worked together a little bit as she's gone through, a few adventures on her knee in recovery. And so I'm really excited to share what she has and what she's learned. And we've got a specific focal point, really, Marisa, on the fact that you had to do a second implant in the same knee. And in fact, that you found, and I won't give it away, but you found maybe a new and novel way to you found some new hardware, I guess, that seemed to be pretty appropriate for your body. So let me stop prattling on, as I tend to do, chatting, and let you maybe just tell us about you and introduce yourself. Could you do that?
Hi, I'm Marisa Rogers, and I grew up in Somerdale, New Jersey. A very active young person, played softball, soccer. I was on the track team, cheerleading. I live now in Woodstown, New Jersey. I've been married for 30 years, and my husband and I have 3 daughters. Our whole family is active. We love to swim, ride bikes, hike, travel. I was a travel agent prior to becoming a middle school teacher. Our family vacations, which we took several, being a travel agent, revolved a lot around physical activities, hiking, Grand Canyon and zip lining, etc. So having limited mobility was tough.
When did the mobility start to become a problem? How many years ago would you say?
So I was 21. I'll have to do a little bit of math here. 35 years ago, right?
Okay, wow.
So I had a skiing accident, and we were in Vail, Colorado, again, because we travel and we do physical activities. There's a mogul run, which, if some of the listeners aren't sure, it's a bunch of small hills along the whole ski run, and causes a lot of wear and tear on the knee joints. So the mogul run was the run prior to my accident. My knee was probably worn out a bit, and I went up one more time. The next trail, my knee just completely gave way. I didn't hit anything. Nobody bumped into me. It bent 90 degrees or so to the far left, meaning unnaturally, laterally, and just popped. I had full ACL reconstruction at 21.
Which knee was this?
The left.
Left. Okay. Full ACL and left. Keep going. Sorry.
So the reconstruction included drilling holes in the femur and the tibia bones, large staples for stability. I had no true ACL. They kind of made one out of my patella tendon. They took a piece of that, made a rubber band kind of thing. And the other ligaments were, torn as well. I had 3 months in a hard cast because back then, about 35 years ago, they didn't realize the trouble that would cause, I guess. This was a lot of immobility, and my knee joint grew a dense, arthrofibrosis adhesion issue.
Sure.
So I wasn't making any progress once the cast came off in range of motion, and I was very young. they had to do 3 arthroscopic surgeries to remove the adhesions over a year and a half. So that they just were growing back. You know, of course, you do a surgery, then there's going to be more because that's kind of what it is. It's scar tissue and it grows. And I tend to have that issue. I was in rehabilitation for 2 years. At that age, I didn't resume normal lifestyle until 23. I did work, etc., but I wasn't quite walking right, etc. And then over the next 30 years, very active. So the knee reconstruction worked well. Didn't do any high-impact sports or anything. But
was that the end of the skiing for you then?
Yes. I did a little cross-country, which is really kind of gentle on the joint.
Mm-hmm.
I had no interest after that.
Mm-hmm.
And didn't really get much arthritis or problems until about 50 years old.
What was the name of the run at Vail?
I honestly don't remember.
No, okay.
But at the bottom, there were many skis lined up at the clinic. Apparently,
yeah.
it was tough.
So
year.
is this the whole thing, like they have to rescue you on the hill and slide you down the whole thing?
Yes.
Wow.
And in fact, a good visualization, I was in a body bag attached to a sled, and 2 of the, I'll call them Red Cross people because I'm not really sure, but they skied me down, attached to a sled, upside down, in the body bag.
Wow.
So I thought if they let go, I'm done for. But yeah, it wasn't.
A moment you'll never forget, right? I mean, I'm sure 50 years later. Oh, wow. And you know, it's this very important joint, the knee, and we need them to do everything, and so much weight, so much pressure on the knee. And when you're doing moguls, aggressively skiing, living your life, you just don't know when something like that's going to happen.
Right.
Wow. So it seems like it's really been a factor in your life all the way, so from age 21, it sounds like, right?
Yeah. Well, over about 30 years there, I was doing well. I just purposefully avoided high impact. You know.
Okay.
I could still do many things, ride a bike, even jump rope, easily enough.
Mm-hmm.
It didn't start bothering me again until age 50. And
Gotcha.
that arthritis kicked in.
So was it a gradual thing, or were you within a short period of time realizing, boy, this knee isn't working out anymore? How did that work?
It was gradual, and I also received injections trying to ward off the pain. I had mostly pain when it rains or cold weather, so I just dealt with it. They didn't really suggest knee replacement because I was young still, and then the injections weren't working. So at age 55, we discussed it and realized after seeing the x-rays of the jagged bone on bone and no more, cartilage, etc., that it was probably the best thing to do.
Right. So how about that exploration that you did? You realized that this is really inevitable, I guess, and so you decided to bite the bullet. Did you explore a lot of different surgeons at the time and techniques and that kind of thing, or did you just have someone in mind?
Right. I did not do enough research. I just took a recommendation from a friend. She had her knee done, and she did well. We're completely different body types, and that'll come into the conversation a little bit later, but the type of knee didn't work out.
So there's a little bit of a lesson right here before we even get into your surgery and then revision surgery, which is do your homework, really know what you're getting into.
Right, and later on when we discuss my new doctor, they make sure that we research because they force you to.
Really?
Good idea.
Interesting. Well, we'll hear about that. Okay, so let's talk about it then. You found a surgeon, decided to go forward. Why don't we talk about that? What happened? Tell the story of that knee.
Yeah. So this was basically last year. I went forward, and first of all, I had an issue with the narcotic, the oxycodone for the pain medication for surgery. Made me dizzy and unable to be mobile. I pretty much was fainting every time I stood. Because of that, I really couldn't get any range of motion early on. I couldn't walk to the bathroom. I had to have someone help me, and I brought a pillow every time I got up just in case I was going to fall down.
Wow.
So I had a lot of trouble with the medication. I thought that was important to mention. So we changed it for this next replacement.
And that was something you couldn't anticipate. Like there was no sense that you
had it before,
okay,
so I didn't
right.
know. And now we put it on like an allergic reaction, but it's more of a just complication, I guess.
Mm-hmm. Yeah.
So that was the first issue. The second issue was because of that, I built up adhesions and scar tissue, or what they call arthrofibrosis in the knee, because I didn't get my motion early enough, and I tend to grow these anyway because it happened when I was young. So I got very stiff. My muscles also had atrophied, the quads, the calf, and it was dramatic as far as the muscles atrophy, because it looked like a peg leg. You know, no calf muscle, and I had an indentation on the inner quad. The skin was hanging loose, but also kind of like indented or curved inward, concave. That was my second big deal. They tried manipulation under anesthesia. It didn't quite work to break up the adhesions well enough. So then we did arthroscopic surgery 6 months after the replacement, and it allowed for some gain of motion. In fact, I used the X10 then, because that's when I had learned about it, and got better range of motion after the arthroscopy, which removed, as much adhesions as they could. But it's difficult to remove them once an implant is in. It's hard to get around all the metal, etc. So,
was this a lengthy debate with your surgeon about what to do and how to do it?
Yes. They don't like to do arthroscopic on knee replacements.
Mm-hmm.
So, and the new surgeon did something different, which we'll get to in another question, I'm sure.
Okay.
So those three issues, the narcotic, the, atrophied muscles and adhesions, and then the third issue is the fact that I had an implant that was now looking like a helmet on my knee. I thought it was going to reduce in size, maybe swelling or whatever. A year later, it still had that helmet look. And many surgeons won't look at your knee for possible revision until a year has passed. So we knew I had issues that weren't being resolved well, but it was hard to get other surgeons for like second opinion to take a look, and my surgeon just said keep exercising. Turns out that the knee I had put in was what you might call a generic type knee used for men and women. They have different sizes, but basically the same shape. And my final opinion, which was a third opinion, he does a different type of knee, and it has a more, he called it a trapezoidal shape, and it has the ability for muscles and tendons to go around it in an angle that's more specific towards women's legs. I might as well say I'm only 5'1", about 120 pounds, so I'm like child size. This new knee was what I needed.
Right. So, and did this come, just this idea of a female knee, come from a specific surgeon, or had you nosed around on the internet and learned about it that way? How'd you get there to this new knee?
I didn't consider looking for, women's knee in particular. I was looking and researching for anything, very desperate, discouraged. Basically, I was depressed because I thought I was going to be crippled forever. I couldn't walk. I couldn't do steps. And I had a lot of difficulty sleeping. I went to work, but all my colleagues could tell that I was in distress, I'm a middle school teacher, but I didn't have my own room. I'm one with a cart, and so I moved all the time, which was good exercise. I didn't mind. It's just with this knee I had a lot of trouble. So I was searching, but I wasn't finding because I wasn't asking the right questions or using the right keywords, let's say.
Yeah.
I found this through women. So I was at a bridal shower, and my husband's aunt said, "You're not looking well with that knee. How long has it been?" Here it was 14 months. She said, "You should be doing much better than that." And, of course, she had friends who'd gone through knee replacements. Her friend's niece had a revision with this doctor that does women's revisions often and uses a specified knee. So I jumped on it. I said, "Give me the phone number," and made an appointment.
And that led you to the specific surgeon that you ended up working with?
Yes. So that realizing that maybe it was an incompatible knee implant, it was a whole different outlook. I now had some hope, I wasn't sure yet, but I spoke to everyone around me. Do you think I should go for this, And obviously you have to talk to the surgeon first, but everybody seemed excited, like, wow, we found something that may be a solution. And the surgeon's name is Dr. Booth. He works in Philadelphia area for ARIA 3B Orthopedics, which is now part of Jefferson. And he does many women's knee revisions. So after speaking to the one woman at the bridal shower, I did find a few others to speak to.
Do you have any? So Dr. Booth is the one you ended up using, right? That was and did you get a sense that you're not alone in this through that practice at all? That other people are finding him?
Absolutely, right?
Really?
Yeah, and I wondered why it wasn't more known, let's say, or why it wasn't offered from the previous doctor that there is a, women's knee, or why it wasn't used. I can only imagine, because I haven't gone back to him, and I want to just, to let him see how I'm doing, etc. But I can only imagine that maybe certain surgeons use certain types of knees for whatever reasons, right, and may not use the other knees for specific reasons. I don't know what the reasons are.
You're right, though. There are a lot of factors, business relationships, marketing relationships, just a general preference for a type of knee, familiarity. I think once you start doing a number of surgeries as a surgeon, you get into your comfort zone with the hardware. There are a lot of factors, and I don't think there's anything nefarious. It's just just how you were raised, or maybe what your mentor used, or what they used in the hospital, or a lot of good research that you've read about the hardware.
And it may work for many women, the previous knee, but I personally had a different, let's say, shape to the leg,
Yeah. Well, and it's funny, I am not an orthopedic surgeon, so I can't start making pronouncements and suggestions on that front, nor can you. But we have a wonderful woman, Marisa, and she is petite, and she had a knee that was oversized, apparently, and this new women's knee for her was an answer. And so there's a circumstance here right now that is a real one where this seemed to make a really big difference. But I'm kind of leading the witness. Go ahead and tell us more about this surgery and the result.
Yeah, well, meeting with the doctor was, very enlightening. He took both legs and checked to see my, flexibility level, to see how they matched up. He actually checked my arms and wrists as well, trying to see why I may not be working well with this knee. And he explained how women's knees have, the way that the muscles and tendons go around is at a different angle than men's. He also mentioned that maybe 25 or so years back, they used the same knee for right and left legs and realized, there's a difference in the anatomy of the legs, and we should have a specific right and a specific left. So maybe we should have knee types for different types of people, That's where he got into this, and it's a Zimmer knee. It's called Next Gen. I don't know the specific model, but that's a good start. And if I had known to look stuff up that, could have found out maybe sooner. And I had been, as I said, like I was a cheerleader, I did sports. I was very flexible and still am. So it may work for other people, but it didn't work out for me with the other knee. It's also a smaller size, different shape, so different than the previous one. Now, that's the knee as far as, physiology, I guess, is concerned. But the arthrofibrosis issue, this surgeon addressed that with radiation. So that's something I think is important to bring up. Anyone out there who's having those issues, he radiated, or actually I went to a different doctor, but they radiated the knee 4 hours prior to the replacement surgery.
Wow.
What that, like a cancer patient, it was, radiation therapy. What that was supposed to do was inhibit the growth of the scar tissue, or adhesions, as they call it, and I tend to grow it hard and fast. So by inhibiting it, it would allow me to get the range of motion maybe sooner.
Amazing.
Yeah.
Amazing. Now, I've not heard of this before, and that doesn't mean a lot. But I have worked with hundreds of knee patients, and this is very, very interesting. So you are clearly a candidate who is going to have a problem later, once again, because of scar tissue. We know this, so let's get out in front of it with the radiation. That's fascinating.
Mm-hmm.
Wow.
This knee is already less swollen, and you can see indents where they should be, like dimples, et cetera, or whatever you want to call it, where the other knee never got there.
Right.
And the radiation may have something to do with that, because the scar tissue probably hadn't grown. Of course, you can't see it, so I don't know.
Mm-hmm.
I also had less of a narcotic. So knowing that I had that issue, we did tramadol instead, Right. Because it's a little less intense. And so I wasn't feeling dizzy or completely out of it. I could move. I got off the cane within a week. So much different and just amazing to me. I was able to get on the X10 right away, and then on the stationary bike, whereas the last time took weeks, and I couldn't. The last time I couldn't do revolutions on a stationary bike until 5 months. This time I did it in 2 weeks.
Unbelievable. Well, let me just pause before we get into that, because I do want to hear about your rehab. But you're just trouble, right? My goodness, the effort, the radiation, the dealing with the narcotics, the fact that this knee's got all kinds of, bad history in it that needed to be dealt with the arthroscopies. Wow.
Right. Basically, the doctor said it's a triple whammy, and I had a really tough time the last year and a half. I've had, a good outlook, but depression along the way. The only thing I can come up with is maybe it was so that I could pass some things on to other people. So I'm very glad to be doing this podcast with you, PJ, so if other people have any issues that might be similar, they can.
I so appreciate you doing this. That's exactly what we're trying to do. We are trying to provide some real life experience, from people that have gone through, whether it's an easy recovery or a challenging recovery, but have gone there before. And you have certainly, in a whole bunch of ways throughout your life, had to deal with this at different stages of your life. And I appreciate the depression and the difficulty that you've had to endure, at a few stages of your life because of the knee. I've heard that many, many times. And you said it earlier, but it seems like Dr. Booth, the fact that there was a female knee, the fact that he adds in the radiation, that he's way ahead of your pain question and the tramadol solution. I mean, you really found a great person to deal with these one by one to get you into a position to recover properly. I mean, bless him. Let's just say it. I mean, you really found a good guy, it sounds like.
Yes. And another thing I want to say is he and his team force their patients to go to a mandatory presentation to learn about knee replacement, the before, during, and after of knee replacement, so that they're not caught off guard or feel that they're having unusual, problems. Let's say he kind of says these problems could occur. Let us know if you have, Also, they tell you to do some strengthening exercises prior to the surgery, which I learned because of the past one. And so prior to the second surgery, I joined the gym. I worked out with the strengthening machines and swam laps in the pool. Even though I wasn't doing great walking and doing steps, I could still do some of the machines and the pool.
Wow.
So I want to pass that on as, I know some people don't have mobility and may feel that they can't do those things, but there's got to be some type of activity you can do to try to build your stamina prior to the surgery, your, flexibility, strength. My therapist, Sarah, because I had her for the previous one, and she felt she wasn't getting me where I needed to be. She said, work on your quad muscles because that's going to give you that stability for the knee joint. So I was more well prepared physically.
Sounds like it. Very admirable. Well, whether you wanted it or not, you had to have this knee become a bit of a vocation, didn't you? I mean, you had to just put your mind on it and your body, and you had to prepare yourself. And we talk a lot, to all of our patients about prehab, whether they're going to prehab on our machine or they're just going to prehab separately. It's a very, very important thing. I don't know, Marisa, if you saw, just last week there was a big article in the Wall Street Journal about prehab and how well accepted it is broadly, and it's what you do now.
Yeah.
And it was really quoting a study, but it was published in the Wall Street Journal just last week, interestingly enough.
No, I didn't. But I want to say at therapy, there was a man who had his done the same week as I did this time, right? And he's out already. He did fantastically. And, of course, he didn't have all the issues I had. But he explained to me that he has a bike and a treadmill at home, and he's, he prehabbed, and he had been using them, throughout his life anyway. And he just soared right through. Of course, everybody's different, but I would definitely tell everyone, to do as much as they can.
Great advice. Well, let's talk about the recovery from the revised knee. What it was like, what you did. You used our X10 machine, so I want to hear a little bit about your experience there. Well, what was that like?
Yes. So I had some experience with X10 after my arthroscopy from my first implant, and I knew I wanted it right away. My insurance doesn't cover it, but I have a Flex Benefits account, and I was able to use that for, partial payment. And I got it as soon as I could after surgery. I did the exercises at the gym prior to, and then jumped right on the X10. I'm going to say probably day 5.
Right.
I had in-home physical therapy for 2 weeks, and he loved the X10. In fact, he wanted me to use it 6 times a day.
Really?
Which I was a little bit, not able at 5 days. But,
right.
But, yeah, I used every part of it because I had been familiar. So, did not only the range of motion, but when I was stronger, started with the strength activities, the exercises, dynamic, concentric, eccentric. Just got on it as much as I could. Like a friend, it motivated me to try harder. If you would take a friend to the gym with you or something like that.
Kind of like a partner in some ways, right? Yeah.
And I'm sure anyone who's had their knee done, we get bored, we get lonely, we're stuck. You're not allowed to drive for a while either. You kind of have to rely on other people. And so my best friend was X10.
What? Let's pretend. Well, we don't have to pretend, Marisa. Plenty of people are listening to this right now, or will listen over the next 6 months or a year, and they're like, "The what? I keep hearing about this thing, but what is it? How would you, in your own words, describe the X10?"
I would say it's a technological item that allows you as a patient to be an integral part of your therapy immediately, if possible, without having a hands-on therapist. So you can also program it in your own way, so it's gentler than a therapist might be.
Right.
So I've been through a lot, so I know. The X10 motivates you by asking you, do you want to go further in your extension toward 0? Do you want to go further in your flex toward, 120 or wherever you want to be? You can decline if you're feeling like it's too much, or you can go further and challenge yourself a little bit with it. But it moves slowly from one degree to another, from extension to flexion, so that you don't necessarily feel that pain that the therapist might do more quickly, And you can work on it whenever you want. So I am usually on it for half an hour at a time and try to do 4 or so times a day. So I don't know if I got off track here, but I would say the gentleness of the way it pushes your leg to where you want it to go, and your ability to stop it or ask it to go further, puts the patient in control and makes the patient more comfortable.
Yeah. We talk a lot about comfort.
I might fight my therapist, not even on purpose, but guarding the knee, I might push in the opposite direction she wants me to go or something.
Fight back, right? Yeah. Well, that's right.
It also has the strengthening exercises, so for the quad and the calf muscles, etc.
Yeah, and it's important to, when you can, and there's a lot of debate out there about when should you start to strengthen. But we all know that, every day that you're not actively living your life, being mobile, out there doing your stuff, you're losing a little bit of muscle mass. And that atrophy can really add up over time. Most people end up with a big deficit. You are, having been so athletic, very conscious of that, and you did all that work beforehand. The last thing you want to do is spend 3 weeks, in recovery and emerge with no quads again, right? So it sounds like you really embrace. Tell me this: when did you start doing strengthening on the X10? How many days or weeks post surgery did you start that?
At 2 weeks, I tried it and did very gentle strengthening. I'm going to say I think it's the calf push, maybe.
Yeah.
The easiest for me, where the hamstring and the quad was tough. So I just do less, Thought I was going to do 10 and I did 3,
Sure.
Whatever felt like I wasn't going to harm myself or, be in such pain that I'd regret it. And then just tried a little more each day. I think I had it for 3 to 4 weeks, right? About 4 weeks.
Yeah.
So by that time, I was really gaining. The numbers were increasing as to how many repetitions, as well as how much pressure I could put.
It's really, we internally at X10, we're talking feverishly about what you did. Not you specifically, but you're sort of a poster child, really, with all those problems. I mean, many people are not going to have the long story of difficulty that you had. They just ended up bone on bone and had a knee replacement. But your approach and the way you delivered the results, and the fact that you got into the strengthening really at a very appropriate time and made the most out of this device, I really admire what you did. I mean, we have lots of success stories. We have lots of wonderful patients, but you've intellectualized this entire process, and you sort of made decisions along the way, and then you put them into play. And it's really great to hear how you did
desperate.
it. Yeah.
I also want to say, when I got to therapy, because I didn't get to outpatient therapy until like the second week, I already was close to 0 and close to 110, and I could do revolutions on the bike immediately, and they were completely surprised.
Wow.
Because the first time I couldn't get around the bike for 5 months, and I had such trouble. So they were like, whoa, what? And I explained, well, between the new knee and the X10, here I am, right?
Right. How long ago, how many weeks post-surgery are we right now?
8 weeks.
8 weeks.
Mm-hmm.
Okay. And so what's life like right now at 8 weeks?
So, before we go on, my physical therapist came to the house, my outpatient therapist, and checked the X10 out. She wanted to see it.
Oh, wow.
Yeah, she really thought that was, all that I showed her was very beneficial.
This is like a movement, We're not out there advertising. We're doing talks like this, I guess, and patients are inviting their doctors and their physical therapists, and it's sort of emerging, this X10 thing, and I hear a lot of patients love to bring their because you found it first, right? Before Dr. Booth, before your PT, you got out there and searched the internet and ended up coming up with this really amazing solution, and it's fun to be able to share.
My husband's an engineer also, and so he, checked it out, and he said, this is what you need, because, you can't go to physical therapy every day, and you can't really apply physical therapy to yourself well,
Mm-hmm.
So and other people are afraid to touch you or they hurt you. So the machine was, like I said before, my best friend, and allowed me to have some control and feel that I was an integral part of, getting better. So
right.
I would do it again and definitely recommend it. If I have to do it again.
No.
Yeah.
No. You're done, right? Forever.
Yeah.
How's the other knee?
I've seen x-rays. It's got a little bit of, jagged bone, and it's slightly off, misaligned a little bit, but they haven't said anything. They told me, my left knee was like an 85-year-old's knee, so I guess my other knee is less than 50, so we're in good shape. Right. You balance it off. Yeah.
Are you back to some activities that you wanted to get back to after this last surgery?
I can walk. I walk up and down the road as one of my activities, and I can walk 1.5 miles on a good day. I can ride the stationary bike. I would probably be able to ride a bike, a regular bike, but I haven't tried because it's too cold.
Right.
And I can swim. The doctor said I'm okay to do that. Those are the normal activities as far as physical. I cannot do the steps yet. My quad just isn't quite able to get the leg over the step. I can do 4-inch steps because I happen to have a sunken living room, but I can't do regular stairs well. I'm going to start work on Monday, so I took the 8 weeks to work out, as much as possible, and when I get back to work, we'll see how that goes. I can drive, put clothes on and off, get in and out of the shower, and I've been able to do that much sooner than previously. Starting about 3 weeks, I was doing several things.
So not quite normal, but normalizing maybe.
Right,
at 8
and
weeks.
much sooner.
Yeah. It's a journey, and 2 months post-surgery, that's a pretty good report, really, to be honest.
Yeah.
And I know that I think the one thing that obviously is still in your mind, I'm sure, is the steps, and
right.
that not quite there, and it could be, certainly could be just the quad strength. It could be, maybe is there much swelling left in the knee?
In one generalized spot. My therapist, because I had so much trouble the other time, believes that I have, let's say, one quad muscle that is overtaking the others, like a bad habit.
Yeah.
And I'm not able to isolate well, which, nobody thinks about till they tell you.
Right, right, of course.
So I have a muscle stimulator as well for that quad. That it's the inner VMO. I believe it's vastus medialis oblique.
Okay.
I'm having trouble with.
I see.
And have had trouble with, and she says I probably always had a lag there since I was young due to that skiing accident, because you wouldn't necessarily notice it if your other quads are working well, So she's not surprised, but she sees that the effort is coming along, and I don't have steps at work, so I just basically work out at home on them.
Right.
And that's the one thing that is annoying at this point, but I can deal with it.
Sure. After all this, well, I mean, you've given us tremendous stuff to think about and a lot of great advice. I know you made some notes before. Did we miss anything that you'd like to bring up now?
I think generally we talked about it, that anyone who's looking into this, first of all, do more research. Ask the doctor what types of knees are available, not necessarily that doctor uses, but in general. And work out as much as you can, even if it's in your own home doing stretching exercises or someone helping you to, cardiovascular, anything prior to the surgery. And then the one observation I'd like to add, I've had a year and a half this time of therapy, and I'm working on more. It's very natural for patients to compare with each other. They may not say it out loud, but like we're comparing ourselves to the other knee replacement patients. And that's good and bad. So I just wanted to go over that a little bit from what I've learned. So every time I see another knee replacement patient, I try to strike up a conversation. But I didn't previously. Previously, I just felt sorry for myself because I could see that older people, and I'm talking, even 30 years older than me, were recovering quicker and just so, hopeless because of that. I wasn't sure why, right? Now I understand, of course, everybody's unique, but that my issues were much more, tough than we realized. So that's a harmful thing if you're comparing yourself and feeling depressed about it.
Right.
But it can be helpful to compare in general to see how the others are responding to therapy, because it gives you like a view of some targets or milestones, that you may accomplish soon or that you see yourself accomplishing and realize you're on target with others,
Yeah.
So at this time, I am sort of in second place out of the 8 or 9 people. We all got our knee done within the same week, right?
Right.
Last time, I was in last place and, so far behind. So the comparative thing, you want to be careful about it, but, say it out loud is probably better than just thinking it to yourself. Either asking the therapist or striking conversations with others. And, you learn from each other as well as put that out there so that I'm telling everybody about this lady knee, right?
Right. Right. It's funny, I'm on the phone a lot with people who are in trouble, and I have milestones that I like to share and, try to help evaluate how they're doing and what's working and what isn't. But, there are reasons for someone to be faster or slower in recovery. And it may not be effort, it may not be dedication. There are a lot of physiological reasons and just knee history reasons. And so, it's I hate the answer of it depends. How fast will I recover? And the answer of it depends is no fun at all. But it can turn into it's probably more true than we'd like to admit, really. Mm-hmm. There's a lot of variability and a lot of variety, and it's really about treating people like you found the solutions that you needed at the time, in the end. And we were trying to hope, and maybe this podcast will help others do the same, whatever their path is toward that.
Right. Yep. I am so excited now, actually, to go to therapy, and I'm very hopeful that in the next few weeks the step issue will be gone, and it could be as much as a year, they tell you, but I think I'm going to be feeling stronger and more normal to myself sooner than that. So
amazing. Yeah. And that's when you'll know you're done. Yep. Yeah, this knee thing, my goodness. Put it in the back, in the rearview mirror. Wow.
Of course, I'm probably going to have it again because they only last, 20 years or so. It's hard to say.
Yeah. I mean, I don't know. I mean, you hear that, but I also hear that there's a lot of confidence in the newest hardware from surgeons, with the hope that 30 years is not unreasonable, for instance.
Yep. Mm-hmm.
So I wouldn't don't sit around and worry about that, I guess.
No. And I'll be more prepared, and they'll have more the good technology, and the X10 will be covered under insurance. So.
Right, it will be, and it'll be Good Lord, I can't imagine where we're headed with our machine in that time frame. I mean, I already know what's happening at the next models that are coming. That is just mind blowing, and that's just going to be in January, February. So,
oh, wonderful! Yeah.
Yeah.
Oh, you know what? We missed speaking about Todd. So Todd was my X10 therapy. Well, he set the X10 up and he helped me learn how to use it twice. And when I had some questions about flexibility and extension, he helped me do some different methods because I happened to be hyperextended on my good leg. So we were trying to even push it beyond zero a little bit. So, yeah, so your representatives are very good about, getting, they're available by phone as well as email, getting back to you and working with you individually.
Yeah, we're lucky to have Todd. Todd is very, very experienced. I think he's coached many hundreds of X10 patients, and he's got great experience with the machine, and he's been, he's very involved in a lot of aspects of our business. So I'm really glad that was a good experience for you. Well, wow, this has been great. And you know what, Marisa, we did take 50 minutes. How about that?
It was worth it.
Right?
Yeah.
So I hope that for those that got here all the way to the end, thank you for listening. This Bee's Knees podcast, about knee surgery recovery is a passion for a lot of people. And the fact that we can, introduce Marisa to everybody and her story, and we can all learn from her. I mean, I get so excited about that. It's precious stuff that we're doing here. So thank you very much, Marisa, for the whole thing.
Thank you, PJ.
I'm Dr. Justin Trosclair, host of 2-time Podcast Awards nominated A Doctor's Perspective podcast. I interview doctors in and out of my profession about their specialties and the occasional non-doctor special guests. But we also go behind the curtain and see what's working for their marketing, overcoming struggles, practical knowledge, book choices, and relationship advice. Join me on any podcast app on your phone or visit adoctorsperspective.net for the show notes pages and free resources. I want you to have an abundant home life as well as a thriving practice. So come on, take a listen.
To learn more, visit x10therapy.com, 1-855-910-5633. Just a reminder, it's a huge help if you subscribe to, rate, and review our podcast. It helps people find us.
X10, back to full strength.